Good morning. I'm Ronna Bach, the Special Nutrition Programs Director for the Food Nutrition Service in the Western Region, and I'm delighted to be welcoming you to today's workshop, which kicks off the 4th public meeting supporting the Institute of Medicine's comprehensive scientific review of Wic Food Packages. On behalf of FNS, I'd like to begin by thanking the committee for its excellent work during Phase 1 of this review. Phase 1 included producing 2 reports, as was just mentioned. The first, the review of Wic Food Packages, an evaluation of white potatoes in the cash value voucher letter report, and the second being the interim report, review of Wic Food Packages, proposed framework for revisions, interim report. The completion of the interim report marked the end of Phase 1 and the beginning of Phase 2 of the current study. Today's workshop supports Phase 2, which focuses on the full scientific review, including a review and critique of the methods used to produce the recommendations and a cost-benefit analysis of the recommendations. USDA is committed to the scientific review process of the Wic Food Packages. It is imperative that the Wic Food benefits be scientifically based, since these benefits are intended to address the supplemental nutrition needs of Wic's pregnant, breastfeeding, and postpartum women and their children and infants. The 2005 IOM report, Wic Food Packages, Time for a Change, was well received by the Wic community, and USDA relied heavily on the science-based recommendations in updating the food packages. We know that as committee members, you take on the task of providing your expertise on top of many other significant research and teaching responsibilities, and we are very grateful to your dedication to helping make Wic the best program it can be. As we move forward with the review of the Wic Food Packages, FNS would like to share some important priorities and initiatives within Wic. First, from its humble beginnings at one clinic in Pineville, Kentucky in 1974, Wic now operates through about 10,000 clinic sites nationwide. Nearly 8 million people now participate in the Wic program each month, including about 1.9 million women, 1.9 million infants, and 4 million children. Approximately half of all infants born in the United States participate in Wic. And Wic continues to serve the most vulnerable populations. Our most recent data indicate that almost 3/4, 72.2% of Wic participants reporting incomes had incomes of less than 100% of the federal poverty level. Providing healthy supplemental food packages, nutrition education, breastfeeding promotion and support, and referrals to health and social services are core components of the nutrition services Wic provides and continue to be top priorities for the Wic program. As you know, the final rule revising the Wic Food Packages was published in March 2014. This rule completed implementation of the first comprehensive revisions to the Wic Food Packages since 1980, a major achievement in the history of the program. The current food packages now place more emphasis on fruits, vegetables, and whole grains, encourage a wider variety of healthy food choices across all food groups, and more effectively support establishment and duration of breastfeeding. Breastfeeding support has long been a hallmark of the Wic program, and since fiscal year 2010, USDA has allocated over $389 million for breastfeeding peer counselors and over $16 million in breastfeeding bonuses to Wic state agencies. These bonuses recognize state agencies with the greatest improvement or highest breastfeeding rates. The fiscal year 2017 President's budget requests $80 million for the Wic peer counseling program, $20 million above the amount received in fiscal year 2016. The $80 million request represents the authorized funding level for peer counseling in Wic. In addition, in 2014, FNS launched a new recognition program, the Loving Support Award of Excellence. This annual award recognizes and celebrates local Wic agencies that provide exemplary breastfeeding programs and support services, and is given at 3 levels of performance: Gold, Gold Premier, and Gold Elite. This approach recognizes 3 groups of agencies that include those that are demonstrating model practices, as well as those at varying stages of implementing exemplary breastfeeding promotion and support practices. In fiscal year 2015, a total of 55 local Wic agencies across all 7 FNS regions qualified for an award. 50 agencies were selected for a Gold Award, and 5 agencies were selected for a Gold Premier Award. Due to the efforts of the WIC program staff, WIC breastfeeding initiation rates have steadily increased over time. Data from the WIC participants and program characteristic report showed that 41.5% of WIC mothers nationwide initiated breastfeeding in 1998. In 2014, breastfeeding initiation in WIC was 69.8%, which represents an average of 2 out of 3 WIC moms initiating breastfeeding. We're happy to report that the proportion of breastfeeding women now exceeds the proportion of non-breastfeeding postpartum women in WIC. Also a priority in the program is child retention. For the past few years, retention of children has been identified as a challenge in the WIC program among children 1 to 4 years of age. In fact, participation drops off each year as the child ages. The reason for the drop-off are not completely understood, but from some focus group testing that WIC state agencies have conducted, some themes have emerged. The social stigma associated with WIC participation, the belief that if one participates in WIC, you may be keeping someone more in need from participating, time constraints, especially for working parents, lack of transportation to get to the WIC clinic, unpleasant WIC food shopping experiences, and the food package and nutrition benefits are not worth the effort of participating. FNS is supporting 6 WIC state agencies through its WIC Special Projects grants to design, implement, and evaluate innovative strategies to improve child utilization of WIC services for retaining children ages 1 through 4 that are currently participating in WIC. Although we've made great strides in nutrition and breastfeeding, looking ahead, we continue to assess what else can be done and what additional barriers to WIC participation exist. Are there new bridges to be formed between nutrition services and participation? Can we strengthen our partnerships at the federal level with programs who serve similar clientele? FNS has undertaken a number of initiatives and actions to address some of these very questions, and our efforts continue. As you may know, all 90 WIC state and tribal agencies are required to deliver WIC benefits statewide using EBT or to seek a waiver by the year 2020. There have been times over the past several years when this seemed elusive due to lack of funding. However, the fiscal year 2016 appropriations bill provided the full $220 million requested to complete the transition from paper to electronic benefits between now and 2020. We should be fully financed on that front and are thrilled to have that security moving forward. As of March 2016, 17 WIC state agencies have implemented EBT statewide. The remaining state agencies are working toward meeting the 2020 deadline and are in various stages of their EBT projects. We have the opportunity to continue to make positive changes to the program during the next reauthorization. The Child Nutrition and WIC Reauthorization in 2010 offered states the option to certify children for 1 year. Almost 75% of WIC state agencies implemented this option, reducing administrative burden while ensuring that children continue to receive the required health and nutrition assessments. The latest Senate reauthorization language extends the certification period for infants to 2 years and opens the program to children up to age 6. Both of these provisions would improve access for children. Other proposed provisions are designed to add efficiency to program operations and to improve program integrity. As always, the Food and Nutrition Service continually strives to improve the benefits and services provided to participants to meet WIC's mission of safeguarding the health of low-income women, infants, and children while assuring compliance with the program's statutory requirements. We look at the critical issues facing the WIC program today: reaching our most vulnerable populations, providing quality nutrition education and breastfeeding promotion and support, retaining participants, and ensuring that we use technology and other innovative ways to improve client services. We must make informed decisions and learn from each other. We enthusiastically look forward to today's workshop, tomorrow's public comments, and the final report the committee will produce as part of this comprehensive scientific review. I will now turn it over to Melissa Abelev, Assistant Deputy Administrator in the Office of Support of FNS. Melissa will be talking about some of the current FNS research and studies supporting the WIC program.